people having a good quality of life isn't just about living longer, but also about how many of these years are disease-free. It's a concept called Healthspan instead of the more familiar lifespan. But there's been a growing gap between the two globally.
And here to share more is Professor Andrea Maier from the NUS Yong School of Medicine. Professor, now globally this gap is increasing. For Singapore, what's our lifespan average and health span average? And are we also seeing the gap between the two growing?
Yeah, so the lifespan in Singapore is 84 years approximately, whereas the health span is 10 years lower. So 73, 74, depends on which definition being used. And the health span here is being defined as health-adjusted life expectancy, which means how many years somebody spends with disability.
How do we calculate that health span, Professor Maier? I mean, there may be some confusion amongst viewers. Why do we have to have a term like lifespan and to differentiate the two?
It's very important to differentiate lifespan versus health span and measure how healthy the population is, how healthy somebody is. So the lifespan is a life expectancy, a certain number we are on Earth. However, the health span is much, much more important. So there are two different types of health span. The first one is when the first incidence of disease occurs. So when somebody becomes a patient, for example, having a stroke or having diabetes or having hypertension of a high cholesterol level, that's very often being used in literature, in academics. However, very often countries are calculating the health span by looking at, okay, how disabled is a person? How much need is there for the activities of daily living? And that measure is also being used here in Singapore.
All right, so-called longevity medicine, that would focus on reducing the degree of disability because we have to allow, or some part of it, say 10 years ago, my eyesight was a lot better, but I would not consider myself necessarily disabled just yet. So when we get older, things will get worse. But even so, there's medicine to take away the worst effects of aging.
Sure. So we are deteriorating constantly in our functions. That's called aging because the time is ticking at this moment in time and we are accumulating damage. And while accumulating this damage, we have a higher propensity, a higher risk for age-related diseases. This doesn't mean if we have a disease that we are disabled, because most of the time that happens either if there is a huge disease like a stroke or if there are a huge number of age-related diseases. So we really have to disentangle both. We can live quite happily with a good quality of life with age-related diseases on the one hand side, and then there is a point where we are disabled and we are needing help. And there is a gap between the health span defined by that disability criteria and the lifespan of roughly 10 years in Singapore and across lots of nations.
Well, we can't escape aging. I suppose it's those big health events that we want to avoid specifically. I mean, we're looking at healthier SG. Singapore has this so-called blue zone. Essentially, we want to see that health span is taking root in Singapore, that more people understand what it means, why it's important to calculate what that might be. We're already struggling with an aging population. We do have one of the world's highest rates for diabetes, as an example, and several other illnesses as well are prevalent up there. How can we cope? Is the health system prepared? What more needs to be done?
I think in Singapore, the health system is prepared, much more prepared compared to other countries. We know why we age. We know why we accumulate diseases. That's what we are doing in terms of research at the Center for Health and Longevity, to really understand the root cause, why we have these age-related diseases. And if we're looking at Singapore, lots of the money being spent in healthcare is now going into preventative care. And I think that's a good thing. 6% of the amount being spent in healthcare in Singapore is going to prevention, whereas in other countries, it's half of it. So I think we are prepared into the right direction, but I think we have to do much, much more, because we can go into precision prevention, where we're really not only looking at groups of individuals, but at individuals themselves, what kind of lifestyle approaches somebody could do, of what kind in the future supplements somebody should take, or even drugs to take to antagonize the aging process to avoid age-related diseases and therewith disability later in life.
Right, when you've got precision prevention, then in a way it's hard to talk about quality of life as a general term, because it's precision quality of life as well. For you and me, what counts as a life worth living would be very different. How, in principle, these are good ideas, but when you execute, talk about longevity medicine, how do you execute so that on average, you are looking at people having a better quality of life for longer, and you can actually justify that?
Yeah. So the first step is getting the basics right, which means all the lifestyle interventions we already know, having a huge amount of sleep, roughly 7 to 8 hours, having enough physical activity, etc. But these guidelines, which are recommended by the WHO, by the World Health Organizations, these are the basics. So then I think there is an arena of work to be done, and especially in Singapore, to see how can we now go into that prevention phase where it's individualized. How much sleep do you need? How much sleep do I need based on my genetics, for example? How much food or what kind of food do I need based on my microbiome or you need? So that's really the new arena of medicine we are introducing. And the research is guiding us. And I would say Singapore is really at the forefront of these developments to introduce that we are not only following the guidelines by lots of societies and the WHO, which is great, but make it very, very tangible for you and me and for everybody in society.
Well, on that point, Professor Maier, with this new arena of medications and interventions that we're seeing, how democratic is that process, though? How accessible is it truly going to be? There are already individuals who are accessing types of treatments that may or may not be considered proven to sort of reverse the aging process or to lengthen your lifespan, but they are accessing it because they have the funds to do so. We don't necessarily know how effective they are, but again, if people don't have the means, can this be a democratic process?
Absolutely, we should democratize health, because this is the good every nation has, to have healthy individuals, to have therewith manpower, and to also have happy people. So that's very important. I would say that Singapore again is on the forefront to not only doing research from preclinical models to humans, to implementation into public health, but also implementing it into clinical practice, the ones which is evidence-based. And I think that's very important, that we need to establish the evidence and then spread it around the hospitals in Singapore worldwide. And there are lots of consortia working on it to be able to have these kind of guidelines to really democratize the health and bring the precision prevention or the health and longevity medicine into hospitals, into GP practices, because in the end, it should not stick in hospitals, but I think it has to be in polyclinics where the nation is being treated and for age-related diseases, and hopefully to prevent these age-related diseases.
Yeah, we cannot underestimate the importance of preventive care. Again, prevention always better than cure. Professor Maier, thank you so much for coming into the studios and talking to us about this important issue of healthy longevity. That was Professor Andrea Maier there, Director for the Center of Healthy Longevity at NUS Yong School of Medicine. Thank you.